Hi there, Dr. Tansavatdi here. So I have gotten a lot of questions of late going over how to perform lymphatic drainage massage at home. In the past, I've sent patients over to some YouTube videos that have been very helpful to demonstrate how to do that on yourself at home. In this video, I want to go over what we can do here at the office. We have what we call the Hydrafacial Machine, and it does allow us to do lymphatic drainage massage for our patients, but also how to do it for yourself at home. Because sometimes people get confused as to exactly how much pressure to apply, where to put the pressure, how to sweep the face with the massage. So in this video, I'm going to show you on myself as well as with the model, as well as on the machine. So now you have three methods there. You can see the whole process of how I would like you to do it at home. If you are following along and this is after your surgery, hopefully this video will be a very good one for you to see and watch to follow along with this. Alright, so to begin with, I'm going to show you on the Hydrafacial machine that we have here the areas that we treat. This is a good demonstration. We'll show a close-up video or a picture of what this looks like, but I want to show first on this machine what we do and the amount of pressure we apply. So I'm going to just turn it on and show you. You can hear that vacuum going, if you can hear the sound in the background. And when we do this procedure, we are literally just putting a light pressure. It takes us about 5 to 10 minutes to do here in the office. If you can see on this video how my skin reacts when I pull on it or push on that vacuum there, it's a very gentle vacuum, okay? So I'm not even feeling it, even though my skin blanched here and you got a little redness in the center. Our main purpose here is to increase blood flow to the skin and draw the fluid into the lymphatic system, which really does not take any pressure whatsoever because the lymphatics don't have veins, they don't have valves. So our arteries and our veins have valves, but lymphatic system itself has no valves whatsoever, so it merely takes about 5 millimeters of mercury pressure to apply fluid to get into that lymphatic system. So here again, I'm going to demonstrate again how much pressure is needed. Very gentle. So the same thing that can be done with gentle massage. So that's just a suction. But when we want you to do the massage, it's a gentle roll where you can see how the skin moves. I'm just pumping the surface of the skin. I don't want to demonstrate, I'm not trying to push heavily, otherwise you're getting the muscle underneath or you're getting fat underneath. What we're trying to move is just the surface skin because the lymphatics are just right underneath that. And so you're going to be pumping and then sweeping, pumping and then sweeping. So I'm going to demonstrate that too for you without the machine, but the first area that we want to treat is certain parts of the face. So let's see if it's going to start. So the nodes that are in our periauricular, I call it periauricular, but these are the lymph nodes just right in front of the ear and then extends down into this area right behind the jawbone. Okay, this is posterior mandibular angle. It's right behind here, and the lymphatic system, there's all a chain of lymph nodes that follow what we call the sternocleidomastoid muscle. So if you follow this muscle, I'm sure you can see it outlined in the video here, but this muscle has an angle and comes down and attaches to the clavicle here as well as the sternum. Here's the clavicle back here and the sternum here. So if we follow along, this is how we get down to the terminus of the lymphatic, of the lymph nodes that drain into the subclavian vein. Okay, so the first 3 nodes that we want to open up is just this chain in front of the ear and back behind the ear, and then we'll sweep down into the neck. So first start is we start at the top of the neck, and it's just a little slight pump and sweep up, slight pump and sweep up. Okay, so we're going to keep doing that. It's what we call a J fashion, slight pump, and you can see how much I'm applying. It's very little just to pump the surface of the skin and then a sweep up. And I'm going to keep doing that. Follow along the length of the sternocleidomastoid muscle down to the clavicle here. So we're going to do that first. Then we're going to start right in front of the ear, pump, sweep down here, pump, and do the same thing all the way down to the bottom here. Then the next step is we go even higher. So now we're going to go at the top of the area where the ear is, and you're going to pump there and sweep and pump here again and sweep and pump again, and follow along the same again. So always start off at the top, behind the mandible, the top of the neck, and sweep down. And then the next step is go a little higher, end here and go down, and then go higher, sweep down, and each time you're stopping at each node as we're going down. That's the first part of lymphatic drainage, okay? That's to open up all the lymph nodes that are draining the lymphatic system. Then if you follow along with what we do here at the office with our Hydrafacial Machine, we're going to move to the areas that are all the segments of the face. So we divide it into lower face, cheek, mid-face, and then the forehead. So the first part is if you've had a facelift procedure with us, if you've had some procedure around the lips, that would be lip augmentation, a lip lift, or if you've had a procedure for the nose, all these areas, this is a very important part to start off with, is you're going to start pumping around the chin. And that is just a little pump here, a little pump here, so these two spots here, and then you're going to sweep along the jawline back. So the sweep, this motion, you've got to understand this again, is a very gentle motion. You don't want to apply pressure. You're not rolling. I know some people will use like jade rollers at home. That's too much pressure. It's literally a sweep of the skin. It's really a light touch of the skin. We don't want to be pushing too hard because you close off the lymphatics. So again, sweep, then you pump again, sweep, pump, and keep going. Then the next part, besides the chin, is then you're going to move to the next segment. That would be this lower cheek. So we would also pump near the nasolabial fold. I want you to pump, and you're going to sweep back, pump. You're going to do the same things again, going back between each node and then following all the way down the neck. And then for the upper portion of the cheek, it's going to be closer to the area right under the eye, and this area of the junction, not at your nose, but just in the middle of the cheek. And we're going to pump, and we're going to do the same thing: sweep, 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 and come down. Okay. And then the last part is the forehead. So the forehead is only if you've had a forehead lift with me, or we also call it a brow lift. That procedure, then you would be doing some of that lymphatic drainage massage for the forehead. If you've not had a procedure above the eyebrows here, then forget that step. But with the forehead, same thing as we're sweeping. We're starting from the middle of the forehead. We're starting above the brow, and we're going to do a light, gentle massage. Again, a pumping mechanism. So we're going to sweep. We're going to come to this temple area. We're going to pump. We're going to come down here, pump, and we're going to go all the way down again as well. Top of the brow, middle of the brow, and then up along the hairline. So those are the three spots for the forehead. Hopefully, when we show you a picture of the demonstration here, you'll also get an idea of the points that I'm using to show you where we do the pumping mechanism and how we sweep back towards the nodes and then down towards the terminus of where the lymphatic system drains into the subclavian vein. In another video, or actually I'll try to put this all into one video, I'll also have a model, and I'll kind of show you gently how that's done. We'll show a close-up so you can see how much the skin is moved and what the pumping mechanism looks like. Okay, thank you so much.